Hello and welcome back. Today we'll be talking about Fezolinetant. We'll start with a brief introduction followed by a discussion of the mechanisms of action. I will then go on to discuss the clinical trials that demonstrated Fezolinetant's efficacy, including the trial's inclusion criteria and the trial's outcomes, followed by the licensed indication, contraindications, and side effects. Fezolinetant is the first and only drug that was specifically designed and licensed to treat the vasomotor symptoms of the menopause, which mainly comprise of hot flashes and night sweats. In the previous video, the link for which is on the screen here, I summarized all the other non-hormonal drugs that have shown efficacy in treating the symptoms of the menopause. However, Fezolinetant is the first-in-class drug to be designed and licensed specifically for treating symptoms of the menopause. The mechanism of action of Fezolinetant is depicted on this diagram. Firstly, though, in order to understand the mechanism of action, we need to understand how the declining levels of estrogen during the menopause leads to the appearance of the vasomotor symptoms. Within the infundibular or arcuate nucleus of the hypothalamus, there are neurons called KNDY neurons, which innervate other neurons located within the thermoregulatory center of the hypothalamus. The KNDY neurons release the neurotransmitter neurokinin B that binds onto neurokinin 3 receptors located on the thermoregulatory center neurons. This leads to stimulation of these neurons that in turn trigger the heat dissipation effectors that result in skin vasodilation, which allows heat loss through both hot flashes and sweating. Now, critically, the KNDY neurons are themselves stimulated by neurokinin B and inhibited by estrogen, as can be seen on the left of your screen, whilst the woman is still premenopausal. During the menopause, however, which is in the middle of the diagram, estrogen levels fall and the unopposed actions of neurokinin B leads to the stimulation and hypertrophy of the KNDY neurons, which in turn leads to overstimulation of the thermoregulatory center neurons. Fezolinetant crosses the blood-brain barrier and acts as a neurokinin 3 receptor antagonist on both the KNDY and the thermoregulatory center neurons, resulting in restoration of thermoregulatory balance and reduction in vasomotor symptoms. The efficacy of Fezolinetant in reducing hot flashes was demonstrated in 2 clinical trials, Skylight 1 and Skylight 2. These were randomized, placebo-controlled, double-blind trials. These trials had an identical design. They were the trials upon which the FDA in the US, the European Medicines Agency, and the MHRA in the UK granted a license for Fezolinetant to be used. The trials included women who were between the ages of 40 and 65 years old and were postmenopausal with amenorrhea for more than 12 months or amenorrhea for more than 6 months with an FSH of greater than 40, or had bilateral oophorectomy more than 6 weeks previously and had a minimum average of 7 moderate to severe hot flashes per day. The severity of vasomotor symptoms are defined clinically by the US FDA and the European Medicines Agency as follows. Mild symptoms having sensation of heat without sweating. Moderate symptoms is defined as sensation of heat with sweating but able to continue activity. And severe symptoms is defined as sensation of heat with sweating and causing cessation of activity. A total of 1,022 women were included in the 2 trials. The trials ran for 52 weeks. The results showed significant reduction in both the frequency and severity of vasomotor symptoms in patients taking 45 milligrams daily of fezolinetant compared to placebo. The benefits were observed after 1 week on fezolinetant and was maintained over the 52-week trial period. The reduction in the frequency and severity translated into meaningful improvement in quality of life. Fezolinetant is indicated for the treatment of moderate to severe vasomotor symptoms due to the menopause at a dose of 45 milligrams once a day. Fezolinetant should be avoided in patients with liver cirrhosis, ALT levels greater than 2 times the upper limit of normal, and eGFR less than 30, and in pregnancy. The most commonly reported side effects in the trials included abdominal pain in 4% of participants, diarrhea in 3%, and insomnia in 3%. Asymptomatic elevations in ALT blood levels greater than 3 times the upper limit of normal occurred in 2% of patients on fezolinetant. No elevations in bilirubin levels were seen. ALT levels returned to pre-treatment levels without an issue, either with dose continuation, temporary dose interruption, or with complete discontinuation of fezolinetant. Whilst the FDA recommends baseline liver function tests to be done and then repeated at 3, 6, and 9 months after starting treatment, the European Medicines Agency and the MHRA in the UK only recommend liver function monitoring in patients with known or suspected liver disease. And finally, how does fezolinetant efficacy compare to hormone replacement therapy and non-hormonal medications in relieving the vasomotor symptoms of the menopause? Well, there are no direct head-to-head trials to compare fezolinetant with other drugs. However, a recently published network meta-analysis looked to indirectly compare fezolinetant with other medications currently in use. This network meta-analysis by Morgan et al. Compared the data from Skylight 1 and Skylight 2 with data from other trials that assess the efficacy of hormonal and non-hormonal treatments of vasomotor symptoms. 2 efficacy outcomes were extracted for use in this network meta-analysis, and these were mean change from baseline to week 12 in the frequency of vasomotor symptoms, and mean change from baseline to week 12 in the severity of moderate to severe vasomotor symptoms. This is the table that shows the mean change from baseline to week 12 in frequency of moderate to severe vasomotor symptoms. 19 studies fulfilled the eligibility criteria for inclusion, and these included 27 hormonal therapy regimens, which consisted of tibolone and various estrogen formulations, which included topical patches, gel and spray, as well as oral tablets and an intranasal spray. The results showed that there were no significant differences between fezolinetant and all of the hormonal therapy regimens. The non-hormonal treatments included 6 different regimens, which consisted of paroxetine, desvenlafaxine, and gabapentin. The results showed that fezolinetant was significantly more effective than all of these 6 non-hormonal treatment regimens in reducing the frequency of vasomotor symptoms. This second table shows the mean change from baseline to week 12 in severity of moderate to severe vasomotor symptoms. 6 studies fulfilled the eligibility criteria for inclusion, and these included 1 hormonal therapy regimen that consisted of tibolone. The results showed tibolone was significantly more effective than fezolinetant in reducing the severity of vasomotor symptoms. The non-hormonal treatments included 6 different regimens, which consisted of desvenlafaxine and gabapentin. The results showed fezolinetant was significantly more effective than desvenlafaxine dose of 50 milligram daily, but there were no significant differences compared to higher doses of desvenlafaxine or compared to gabapentin. In conclusion, this network meta-analysis of indirect comparison between fezolinetant and both hormonal and non-hormonal treatment regimens showed fezolinetant to be equipotent to hormonal therapies and significantly more effective than non-hormonal therapies in reducing the frequency of vasomotor symptoms. However, regarding the effectiveness of fezolinetant on the severity of vasomotor symptoms, fezolinetant was significantly less effective than tibolone and equipotent to desvenlafaxine at higher doses and to gabapentin at reducing the severity of vasomotor symptoms. It's definitely safe to say that there is a need for head-to-head trials to compare fezolinetant's effectiveness to both hormonal and non-hormonal treatments. I hope you found this video useful and enjoyable. If you did, please don't forget to like the video, leave a comment, subscribe to the channel, and turn on notifications so that you get an alert when the next video is published. And I'll see you next time. Thanks for watching.